Okay. Good morning, everybody. Thank you all for being here with us today. We are very happy to have members from our Speakers Bureau with DSS come back today to go over the Understanding Medicaid and Community Long-Term Care discussion that we've scheduled. I think there are about 75 people that are registered for today, which is a pretty good group. So we're excited to have you guys here and learn what they have to share with all of you. Just some quick housekeeping. If you are in the meeting and you are here under someone else's name because you registered through someone else or you are through a link that someone sent you, please make sure that you put your email in the chat so that I have you added onto our registrant list. If you registered yourself, I already have the list of emails of folks who have registered and you guys will receive the materials after today's session. I just want to make sure that if you're under someone else's name that you don't miss out on that. Everything will be sent out. There will be a link for our YouTube channel that will have the recording of today's session included, and it will also be posted on our roundtable announcement hub so that you guys can access it and view it if you need to share with other staff as well. If anyone has any questions, please put them in the chat or in the Q&A feature. I will monitor that throughout today's session. Callie and Morgan are here today to do the presentation, and I think the preference is to save questions for the end, but if there's anything that comes up, or there are any natural pauses, we'll do our best to get those answered. And then if there is anything that we, for whatever reason, can't answer today, I'm sure we will work with together to figure out how to get that information out to you guys after the fact. So thank you very much, Callie Ditzian and Morgan Murphy, for being here today. I'm going to turn it over to you guys.
All right. My name is Callie, and I'm going to be starting with one type of our medical, and then Morgan's going to take over to talk about some more of our long-term care medical. So let me just get this up. All right. So we're going to start by talking about kind of who is eligible for Husky Medical and what it really is. So there's a few different types of Husky medicals. There's Husky A, that's primarily for children and families. Husky B, which is for children whose families go over the income thresholds for Husky A. Husky C, which is for those over the age of 65 or who are disabled. Husky D, which is for adults without children and who are not pregnant. And there are certain other Husky limited benefit programs for certain types of diseases such as tuberculosis, breast cancer, or cervical cancer. So there's two main entities that deal a lot with the Husky health. So Husky C and the Medicare Savings Program are determined solely by DSS. Huskies A, B, and D are determined primarily by Access Health. It's always a good idea to start with them when you're doing applications and things. And if there are issues, you can definitely reach out to DSS. This is the income thresholds for that A, B, and D. The income thresholds are by family size and by program. So you can take a look at that. It's always on our website and gets updated about once a year when the income limits change. So I want to talk a little bit about the Medicare Savings Program. For the Medicare Savings Program, a person has to be eligible for Medicare and on Medicare A. They have to be a Connecticut resident within the income thresholds, and they must either be a U.S. citizen or a qualified immigration status. The Medicare Savings Program works in conjunction with Medicare. So Medicare is a federal program, and Medicaid is state. The Medicare Savings Program kind of ties the two together and is state funded. So these are the income limits for that Medicare Savings Program. There are three levels of the Medicare Savings Program. So the top level, the QMB level, will cover your Part B premiums, as well as co-insurances at doctors and hospitals, and can help with certain pharmacy costs. The SLMB and ALMB do not cover the copayments, however, will cover the Part B premium. The ALMB cannot be tied, however, with any other types of Medicaid you may be on. So we're going to talk a little bit about how to apply and renew your Husky coverage. So as we said before, Husky A, B, and D are handled through Access Health. So it's a good idea to either give them a call at the phone number here or go on their website. They are able to do applications for Husky A, B, and D over the phone. If you're applying for Husky C or the Medicare Savings Program, you can apply online through mydss.ct.gov. You can call DSS to ask questions about these programs, but just know that we cannot take a verbal application for these programs. So we'll either need an online application or a physical signature. This is just kind of a preview of our website. So if you go on to apply or do anything to make changes, this would work for your Husky C, SNAP, or cash programs. It can be used to apply, renew, or report changes. And this is Access Health's website. So if you're just looking to do Huskies A, B, or D, it's always best to kind of start here. Also know with a lot of our medical programs, we can try to review for retro coverage. If you are looking for retro coverage, we do need to verify your income for the months in which we are looking to screen, because you do have to have had eligibility for those months. These are just a few general things to remember when you're dealing with DSS and submitting documents to us. So if you're going to mail us documents, try to include a FastLink cover sheet. You can make these on our Connect CT website. It allows you to put the client ID and case number right on the document to make sure it goes to the case. If you don't have a cover sheet and are going to submit it, make sure that you write clearly on it, client ID number with the number and case number. This ensures it goes to your case. If it goes in as an unknown document not associated, it can take a while for us to find it. Also, if you're working to assist clients, we ask if you can make sure 298s are on file. You can get these off of our website or clients can obtain them. This allows us authorization to speak to you. If you call and you are not an authorized representative and you don't have the client with you, we cannot give you any information on the case. Remember that the My Account online can be used for any changes, renewals, all of that. So it's great for the clients if they want to use them. It makes the documents go straight onto their case. And just make sure clients are reporting their updated contact information to them. We see a lot where people move, they assume they reported a change of address to the post office and your documents will not get to you from DSS. The post office is actually not allowed to forward Department of Social Services mail. So if they don't provide us the updated address, it's likely not going to get to them. And this is just some of the contact information for DSS at our office hours. Morgan, I'm going to hand it over to you for the long-term care and Husky C end of things.
All right. Share screen. All right. Is it showing full screen?
It is, yeah.
Okay, thank you. All right, so now I'm going to talk about Husky C and go more into detail about Title 19 Medicaid, which includes home care services. There are both non-financial and financial requirements for eligibility. They must be a Connecticut resident, either a US citizen or a qualified non-citizen. They must be 65 years or older, legally blind, or have a disability determination from either the Social Security Administration or from Colonial Cooperative Care. For the most part, there's a $1,600 asset limit, $2,400 for married couples. I'll go over the exceptions to those limits later on. Husky C can refer to what we call medical aid for the aged, blind, or disabled, which provides medical coverage only. Or it can refer to Title 19 Medicaid, which provides both the medical coverage as well as long-term services and support. For a list of Medicaid covered services, you can visit huskyhealthct.org. Medicaid for the aged, blind, or disabled, sometimes referred to as S-Track, S is in Samantha. There are several different coverage groups within that, that S-Track. I'll go over in further detail about a couple of them. There's a $723 a month income limit after disregards for a household of one. If the client is over the income limit, they could still qualify for a Medicaid spend down. There's a 3-month look back of assets or a 2-year look back if they're also applying for cash assistance. At S99 Medicaid spend down, any excess income can be offset by qualifying medical bills. A spend down period is 6 months. Once the client has met whatever their spend down amount is, their Medicaid coverage will kick in from then on for however much is left in that spend down period. And medical bills can be sent to the spend down processing center. Here's an example of a S99 spend down. Let's say the client's gross income after disregards is $800. We'll subtract that $723 income limit to get a $77 difference per month. Then we'll multiply that by 6 months to get $462 of a total spend down. Once this particular client has incurred $462 in medical bills, their medical coverage will then be activated for the rest of the spend down period. And SO5, Medicaid for employees with disabilities. This is for clients who are also working. It has a $10,000 asset limit, $15,000 for married couples, a $6,250 a month income limit for the client. The client could possibly have a premium depending on their income. From this point on, I'm now going to focus on Title 19 Medicaid, which includes the W01 waiver program or home care. Title 19 Medicaid, it's a combination of both health coverage as well as long-term services and support. It does require a 5-year look back rather than just the last 3 months. Long-term services and support, it provides a broad range of medical and personal care assistance for clients who have difficulty completing self-care tasks due to aging, chronic illness, or disability. They can be received in an institutional setting or at home or in the community. If you hear the term community options, it's referring to the home and community-based services. Skilled nursing facilities provides high-level medical and custodial care within a licensed facility. The system we share with the skilled nursing facility will need to state what the functional level of care is. For Title 19, there are financial requirements as well as functional requirements. The DSS caseworker will review the financial side of it. The functional assessment for home care depends on which waiver the client is seeking. If they're over the age of 65, they'll need to call the alternate care unit to set up a functional assessment with one of the access agencies. On this PowerPoint, you'll actually see 2 different numbers listed for the alternate care unit. Both of them work. Just as a heads up, there's also a state-funded home care program. We call it the MO3, M as in Mary. This is for clients who are 65 years or older. This does not include Medicaid coverage, so it's not part of W01 and it's not considered a Medicaid waiver, but it does have some different financial requirements that might better suit the client's current financial situation if they're not eligible for a Medicaid waiver financially.
Would that be because their income is too high or too low? Sorry.
Too high. So if someone is over, a lot of times it's usually because someone is over the asset limit for Title 19 Medicaid. So let's say they have $20,000 and they're unable to spend down quickly, then they'll be denied Title 19 Medicaid, and we'll refer them over to the alternate care unit to see if they can get the state-funded home care program. And then if at a later date they've spent down those assets, then they can be re-referred back over to us to try and get services under the Medicaid waiver.
Thank you.
Yep. Here's a list of Medicaid waivers that we handle. H01 is similar to W01, but it's for clients who are 21 years old or under. The H01 has a $1,000 asset limit for the client. The Connecticut Home Care Program for the elders, AKA the elder waiver, that's about 80 to 85% of the applications that we process in our unit. The Department of Developmental Services is the next most common one that we see. Along with a W-01 or an H-01, someone can actually receive waiver services under that S-05 Medicaid for employees with disabilities that I mentioned earlier. Oftentimes, I'll see DDS clients granted waiver services under those S-05 financial guidelines. And the last 5 listed here: mental health, personal care attendant, acquired brain injury, autism, and Katie Beckett. We don't see a ton of them as caseworkers, as they have wait lists, unfortunately, due to very limited slots being available. As far as who to contact for referral for these waivers or to inquire about what specific services are offered under each waiver, for DDS waivers, you can reach DDS by email or by phone. With DDS, they're usually pretty involved in trying to help the client through the financial application process, so that's great. For mental health waivers, you can contact the Department of Mental Health and Addiction Services. And for more referral information on the other waivers, including the elder waiver, you can call the alternate care unit. When you do call them, it's going to give you like a list of options, and you're just going to listen out based off of which waiver you're inquiring about. As far as what we do as eligibility workers in the Greater Hartford office, when an application comes into our unit, it gets screened into our system and assigned to a caseworker. If the client is 65 years or older, it'll be processed as an elder waiver application. Just remember that the client will still need to have a completed or at least a pending functional assessment by at least day 30 of application, or they'll be denied. There's no wait list or limited slots for the elder waiver. So if you're over 65, it'll be an elder waiver. If the client is under 65, we'll send an email to the waiver liaisons asking if the client is known to their waiver and if a spot is currently available for them. If there's no spot currently available for them under any of the waivers, the client is unfortunately not eligible at that time and their case will be denied. If the client is known and a spot is available for them under a waiver, the worker will proceed to the financial review. And if and when the client is determined financially eligible and the case is granted, the worker will inform the waiver liaison afterwards for them to go from there. As a side note, if I ever have to deny someone for not having a waiver spot available, I'll see if they can at least qualify for that S-Track Medicaid that I mentioned earlier and advise them to call 211 for more information on the Community First Choice program. There's just another avenue for them to receive some support in the home. And for more information on that program, they can call 211 or they can also visit ctmfp.com. I'll put that in the chat. Some required documents: a completed W-1 LTSS application form. You can find a copy on our website. The more the caseworker is made aware of at the start of the application process, the smoother the process typically goes. So the more accurate and complete it is, the better off everybody is. Proof of current gross income, excuse me. We always go based off of before taxes or any type of deductions. A 5-year history of assets, proof of marital status, any power of attorney, conservatorship, or guardianship documents, if applicable, and the W-298 authorization form if the client wants to give DSS permission to communicate with anyone else regarding their case. And lastly, if there's any private medical insurance providing proof, and if they pay a premium, make sure they send proof of premium as well if it's not already shown on the bank statements. There are more documents that may be needed. These are like the most common ones, but the caseworker will, advise on anything else that's needed. Here are some examples of assets. The client may have all, some, or none of these. If the client is married, we'll be reviewing the spouse's assets too. Irrevocable funeral contracts can have, in Connecticut, can have a maximum of a $10,000 value and be excluded. Annuities and trusts get reviewed by our legal team because they can get kind of tricky in terms of how they're treated and whether they're counted or not. The purpose of the 5-year look back is to investigate assets and any transfers of assets. The way that I try and explain it to people is that I'm basically looking at 3 things: what type of assets they've had, what did they do with any assets they no longer have, and did they receive fair market value for any assets that they transferred. What we're trying to do is ensure that an applicant is not transferring assets for the purpose of qualifying for services. Any assets that are co-owned or jointly owned still need to be reviewed as well. It's always easier for us when the client has their own accounts rather than commingling funds with others. We definitely need verification of transactions of $5,000 or more, but the caseworker can certainly ask about transactions under that amount as well. A few common things that I'm looking for when I'm reviewing bank statements: if I see insurance premiums, I'm going to ask for follow-up information about what type of insurance they're paying for. If I see transfers to or from another account, we want to see if the applicant also owns that unknown account as well. Or if we just see particular patterns going on periodically, then we'll ask for follow-up information about that as well. The worker will review and advise what assets are excluded from the asset limit versus counted. If the client is over the countable asset limit, the worker will advise what assets are currently putting them over. If there's an improper transfer and a penalty period is applied, the penalty period would begin when the caseworker would otherwise be ready to grant the case. The length of a penalty period in months would be whatever the value of that improperly transferred asset was at the time of transfer, divided by $14,524. That amount does change. Just as an example, let's say someone had a $30,000 improper transfer that we're penalizing. That would be a little over a 2-month penalty period that they would have to wait before they can receive services. Just because an asset was transferred doesn't necessarily mean it was an improper transfer or that a penalty will be imposed. The caseworker will review the situation and the circumstances and advise from there.
What is determining that $14,524? Is that because it's under the 15,000?
No, so a good question. We go based off of the average cost of skilled nursing facility care in the state of Connecticut. And we apply that for both facility cases and home care cases, but so that amount will increase each year. At this particular time, the average cost of skilled nursing facility care in Connecticut is that $14,524 amount.
Thank you.
Yep. The income limit for home care right now is $2,829. Examples of income: Social Security income, pensions, alimony, workers' comp, wages, annuities, etc. If the client is over the income limit, the only way for them to still be eligible for W-01 is by establishing a pooled trust through the plan of CT organization. And that's where they designate a portion of their funds to pay for specific recurring living expenses. The patient liability amount, sometimes called applied income, is the monthly amount the client is expected to pay towards their own care. The personal needs allowance for W-01 right now is $2,510. Any amount over that $2,510 will equal the client's patient liability amount unless they have another one of these deductions listed. The most common deduction that we'll see for W-01 is the health insurance premiums. So like I said before, if they do pay an insurance premium, please make sure they mention that on the application so the caseworker knows to request proof of it. I'll say that for most W-01 cases that I've had in my experience, there is no patient liability amount, just because it's kind of a tight window between having more than $2,510 a month, but less than the $2,829. But every once in a while, we will see it. For spousal cases, we call the spouse not seeking LTSS the community spouse. Their asset limit, called the community spousal protected amount, will range anywhere from $50,000 to $154,140. that amount does change as well. It's the couple's total asset limit is calculated by taking the couple's total combined assets as of the date they were considered institutionalized, dividing by 2, and adding the original $1,600 limit given to the client. Once the community spousal protected amount is calculated by the caseworker, the couple will need to reduce their assets down to their given amount, and they'll need to provide proof showing that they've received fair market value in the process. So keep copies of checks, bills, invoices, receipts, updated bank statements. A client can complete an online application or mail a completed W-1 LTSS to the Greater Hartford office. The W-1 LTSS is the application we're strongly encouraging, as is detailed in it. It gives specific LTSS financial information that we need, whereas the online application is very generic and more so tailored to the other programs that DSS offers, like SNAP, for example. Like I said, a W-1 LTSS can be found right on our website. I want to again state that filling out a complete and accurate application and submitting all verifications timely will result in a smoother process. Remember, if they're applying for the elder waiver, they do need to also contact the alternate care unit to get that functional assessment scheduled. Sometimes that can take a while because the access agencies can be backed up quite a bit. So the sooner you call, the better, because it may take several weeks before they can get out there. For the other waivers, they'll need to reach out to the appropriate contact mentioned earlier for a referral and to get put on the wait list if that particular waiver has one. If the client has any trouble getting verifications in, please have them or their authorized representative reach out to the caseworker as soon as possible. And lastly, I want to add, when someone is granted services, please make sure that they get those renewals in on time. It's always easier for someone to have their services continued rather than to fall off of the program and then have to go through the application process again to get back on it. And that's all I got.
Thank you, Morgan. Does
No
anybody have
problem.
any questions for Morgan for the LTSS portion? I know that we have an aging population within our system, and waivers and long-term care services and everything is something that's sort of top of mind for a lot of us. Okay. Does anybody have any questions for Callie regarding the first portion of the presentation today with the Husky stuff, I know Callie kind of went through the slides pretty quickly. Does anyone have any questions about eligibility, process, what is and isn't included in Husky A, B, C, D, and the limited benefit section?
I'm sorry. I have a question.
Yeah.
If someone works in New York, but they live in Connecticut, would they still be eligible for Husky?
Yes, so the requirement is a residence requirement, so you can work anywhere technically in the country as long as you reside in Connecticut.
Okay.
So we do occasionally see people even with telework jobs that work even farther than New York. As long as you can verify physical residence here in Connecticut, you're fine.
Okay, thank you.
Lynette.
Hello, good morning to all. I have a question, like as far as Husky, when you're denied, and if you're like a non-resident of the United States, are they still eligible for the, I think it's called Connecticut? Like it's like like it's another insurance, I think it's like a deductible for taxes.
So there's certain things through the portal. A lot of times that stuff is not actually covered by DSS. So children right now up to the age of 12, even if they're undocumented, could be eligible for what we call the J-Track coverage. That J-Track coverage does follow, it mirrors Husky A's income limits. So if they're under 12, they could always apply. If they are pregnant, they could apply, and we have pregnancy coverage now for all citizenship statuses. Beyond that, they would have to call Access Health to see what they're eligible for as far as purchasing a plan or seeing if there's a tax status.
Anybody else?
It looks like we have one in the chat. So for rental income,
Yes.
it is the gross amount. However, we can give disregards for certain things, like expenses used against it. So business expenses.
I think there were a couple people that popped in after you had presented, Callie. Can you just explain quickly what the disregards are?
So for Huskies, you're saying for the Husky
Yeah,
A's?
just is it kind of like when you're looking at asset limits, is it sort of like
Yeah.
that type of
So
concept?
Husky A, B, and D have no asset limit. Morgan's programs, the Husky C's are the ones with the asset limits. So Husky A, B, D, and the Medicare Savings Program have no asset limit for the program.
Okay. Any other questions? There's no such thing as a stupid question. So if you have a question, please ask it. Okay. Quiet group today, but we got through it. Thank you so much, Morgan and Callie, for your time today. I appreciate all the information that you shared. They will be sending me their slides, so I will be sure that all of that goes out to everybody so you guys can take a look at the charts and everything with regards to income and all that other stuff that was reviewed earlier. If anyone has any follow-up questions that either you're too shy to ask now or you want to, it comes in your mind after today's session, please email me and I will make sure to forward that along and get that answered for you guys. I hope that this was somewhat helpful, and I hope that you guys stay dry because if you're where I was, there was horrible rain just a little while ago. Thankfully, my power didn't kick out. But you guys take care. Thank you so much, and I will make sure that everything gets sent to you and the recordings will be posted as well.
Thank you. Have a good one.
Thanks. Take care, everyone. Bye-bye.